like, I just turned 23 and I spend a good 60 to 80% of my life just in bed, sleeping or just laying there because I am physically incapable of doing something else.
On the concrete level, it's pains.
It is a nightmare, a living hell.
A curse. Actually, it's just been that I've lost so much and I won't get it back.
In a healthcare system designed by men for men, a lot of women struggle with pain that is not properly researched, diagnosed, treated, let alone cured. One of the most common, yet least known, is endometriosis.
I remember I got my period when I was 11. Then at 12, the period pains changed. Like, they really started to hurt to the point where I couldn't go to school. I was vomiting. I was fainting. We didn't really know what to do. And it was always described as like, oh, well, you're a woman now, and that's how period pains are. And, you know.
It is estimated that globally, up to 10% of women suffer from the chronic inflammatory disease endometriosis. A lot of patients are not diagnosed until after they have suffered years of pain and countless doctor's visits. Incorrect diagnoses and treatments prove unhelpful, and one of the main reasons for this is the inadequate training of medical professionals.
I first got problems with stomach pains when I was 15 years old. So that's like 25 years ago. And they did various gastroenterological research on my tummy for like 20 years. They didn't examine me gynecologically. I had a very engaged doctor that was a professor, and he said that my case was so rare because it was so hard to diagnose me, because they knew that I had the pains and that there was some kind of inflammation in my body, but they couldn't locate where it was.
So when I was 16, I was at home with my mum, and it was just going on for hours and hours and hours. So my mum said, that's it, I'm phoning an ambulance. And I just looked at her and I was like, don't you dare. Don't you dare phone an ambulance. How embarrassing to be like, hi guys, I've got my period, so can you come get me? After that one incident, mum said, right, okay, if you don't want to phone an ambulance, we don't have to, but you need to seek help. I went to a midwife and she just looked at me and said, yeah, well, it does hurt to be on your period. That's what it's like to be a woman. And then sent me back home. From that first encounter when I was 16, it took me 6 years to get diagnosed with endometriosis. And during those 6 years, it was meeting with loads of different doctors. I went to a GP. I told him my symptoms, my pains, my struggles. He stood up and he shouted at me and he said, you don't have endometriosis, get out. And he literally just threw me out of his office.
The manifold stories of long, painful journeys towards an eventual diagnosis and proper treatment raise the question, why is it so hard to diagnose patients with endometriosis? For Dr. Meilin, it is simply due to a lack of knowledge.
I did a talk to a group of gynecologists that work with infertility. There actually was a doctor there that said, is this really a disease? We need so much more knowledge and so much more education. And like in the nurses' school and medical students' school and everything, you have to start early. School nurses, teachers, primary care physicians at the vårdcentralerna, they need to know about this. For me, it's just 5 questions you need to put to the patient to see if this can be endometriosis. But then we also have the problem, we don't have any easy diagnostic tool. you still have to do a laparoscopy, an operation. We don't have any blood tests. You can't see endometriosis at a regular gynecology examination. And I think a lot of my colleagues, they don't go to the next step. They do the examination and say, everything looks fine, so you can go home. And they don't explain to the patient, but it can still be endometriosis. And maybe we need to do an MR scanning or an operation. But this is something that every gynecologist should know about. This is a common disease. We think that it's about 10% of all women have this. So it's a very common patient that comes to a women's clinic.
The journey of endometriosis, however, does not end with a correct diagnosis. As there are currently no cures, and the only treatments available are those that alleviate symptoms, which, by the way, may or may not work, patients must drastically adjust their day-to-day lives.
I hate this fucking disease. I've been feeling good for a long time, but waiting to change my hormone spiral. And until that happens, I'm probably going to be pretty miserable off and on. Today is a bed sick day. I'm laying here with my handy dandy heating pad and trying to switch it from my left ovary side to the back of my leg, where I have pain from the endometriosis that's on my nerve, I suppose, that sends shooting pain down my leg. Awesome. Not so much.
When I was 35, I realized, well, this doesn't work. I need to do something. So I wanted to be sterilized. I don't have kids. I don't want to have kids. That's something which has been like a normality for me my whole life. Yeah, when I was 30, I moved to Linköping. So basically all of that time was trying to find something here. And also all of that time being met with, well, you're young. Of course you want to have kids. You don't know what you want. But if you get pregnant, it will be fine. You'll see what you want. Or when you get older, you will want to have kids. So when I got to the hospital, after like 10 years of being told this, I was really fed up with this. So I met the doctor. He was actually pretty nice. When I told him about the pains and the heavy periods, he was like, well, this might be endometriosis. And my first reaction was like, no, it's not. Because I didn't want to have anything to do with the gynecologists. I just wanted to have the sterilization and then be done with it. So he did an exam and he said, okay, but I just want to check with a colleague before I sign everything off. So he went to get her, and when she comes in, first thing she says, she looks at me and says, okay, I'm an IVF doctor. I meet patients every day, all day. They want to have kids. And now you're here. And I was just sitting there like, well, yeah. What am I supposed to say to that? Am I supposed to rent my uterus to them or what? I was so shocked. I didn't know what to say. I just said, well, I just want to get sterilized. And she didn't want that. So I think I sat for an hour just really saying, I want this, and trying to describe why. When they opened me up to do the laparoscopy for the sterilization, that's when they found out that it was endometriosis and the worst kind. When I woke up after surgery, they said, well, you're not sterilized. We couldn't do it because we couldn't see anything. Your insides, it's a mass. We couldn't see what was the uterus, what was the ovaries. We took away as much as we could, but this is really bad. And that was a huge shock.
You have these cells that are very similar to the cells inside the uterus, but not identical. And these cells are on the outside of the uterus and getting attached to the ovaries, the intestines, the urine bladder, and the inside of the wall in the abdomen. And they got stuck there and they start to grow. And when the woman has her period, it will bleed inside also in these lesions. And that will create a big inflammations, and it will create a lot of pain. Endometriosis can lead to infertility or at least subfertility. So when you stop with your birth control pills and try to get pregnant, all the pain comes back and you don't get pregnant. So that is a moment where you might seek help. But some women don't get the diagnosis until they are over 40.
My egg stockar is tied behind my uterus on both sides, like stuck with the glue. In 2020, they told us in January that the probability of you getting pregnant also through IVF will probably not happen. You still have one try left and you can do it, but you should also consider putting up for adoption. 1 month after that, we got pregnant naturally when everyone told us that it will never happen. But I never felt better in my whole life with pains for those 9 months. It's like I got to become that person that was the healthy person. Even though I was still on sick leave for exhaustion syndrome, the pains were better. I had really big fears of how will my endo interfere with the pregnancy? Will it be a danger to my child during the pregnancy? Will she have the space to grow? And also the fear of the birth, because I was scared that will my endometriosis make it hard for her to get out? So I had those two fears all the time because I felt out of control. And it turned out the labor was really tough because of my endometriosis. And that, I think, is one of the major problems. You have the endometriosis specialists, and then you have the IVF that doesn't specialize in endo. And you have also the mother care, and you have the labor nurses, doctors that aren't particularly specialized in endometriosis. So when we ended up being in labor, the specific moment of the labor happening, and I said, no, now it's stopping. She can't get out. My biggest fear happened. There was no plan and no one knew what to do. I was looking all the time at her, the machine showing her heart rate and things like that. And I was like, now it's happening. My biggest fear, she's not getting out. The nodula that I have in my intestine was the one stopping the process. So the journey was hard because in some ways my fears came true. It's still the most amazing thing that she is here because we've been longing for her for so many years.
I tried to do some exercise, and I mean, it felt great to finally be moving and doing something, but I definitely overstrained myself, and so I ended up being home this whole week. I was supposed to work for 2 days, so really nothing major, but still wasn't able to do that. So it's been a full week now, and the swelling has started to go down today. All throughout the weekend, though, before I did the exercise, it swelled up. I don't know why. I don't know if it was something that I ate. I don't know if it was something that I did. I don't know if it just did that. Sometimes that happens.
Good morning. About to take my daily dose of medicine. This is how much I take on a day that I have pain. When I have things under control and don't have pain, then the pink one and the 2 big white ones I don't have to take. But today I still have pain, so I have to add those. Bottoms up. Cheers.
To deal with the often debilitating pain, medication is an essential companion for affected women. Yet, a lot of patients recount being stigmatized as the irritating patient who wants stronger meds, or are even labeled as drug addicts.
I was scared of how I was going to be perceived, because I learned more and more after the diagnosis that, oh, okay, there's this like hidden stereotype that I didn't know about that comes with endometriosis. It feels like they've already marked you, like branded you, that this is the person you are. You have mental issues, you are overly reactive, you only want really hard like pain medications such as morphine or diazepam. So basically, you're just here for drugs. That was something that shocked me, scared me, and hurt me. I don't want a bloody superpower. I'm just asking to be as normal as I can be and as productive as I can be and just a part of the society. That's all I ask.
I think that's the same. It's how much they know and how much they're interested and how much time they have. Because in the ER, I think it's easy for them just to say, okay, you're in pain. Oh, you're not dying. So, okay, just take paracetamol and take ibuprofen and just go home. And if it's worse, then you have to come back. And also, since it's really hard to see the pain from the outside, you can see if someone faints or if they're white. But if there's not really a swelling or something's red or some indication that something is really, really wrong that they're used to seeing, then they don't understand. It's more like, okay, but you're just faking it. You just come here because you want morphine.
No, I heard that a lot, actually, with the morphine. Being labeled a drug addict also.
Yeah, I've had that as well. I've gone in a few times in this. I need morphine now. It's like, it's really painful. And they're like, no.
Yeah, like a couple of months ago, I had to pee in front of a nurse. Like, I wasn't even allowed to pee by myself because they had to see that I was the one peeing just to check the levels of morphine because they was like, is she taking too much?
Wow.
And like, I'm 20. Like, that was so hard.
Yeah.
And I was like, why do I have to do this? And the nurse was like staring at me and I was like, how am I supposed to pee now? That was very stressful.
Yeah.
Apart from painkillers, hormonal treatments are a common approach to deal with the symptoms of endometriosis. However, they too come with a heavy load of side effects.
The only thing that they would give you as treatment would be, here's some pills, swallow them, here's some hormones, take them. And then that was it. I think I've tried every hormone on this earth, even GnHR, which is a hormone that makes you go into early stages of menopause. So I've been in menopause when I was like 22 years old. And this hormone is so severe because you can take it different ways. And I took it as a nose spray. It's not only destroyed like my whole entire inside of my nose, I was in so much pain from that hormone. But it's just like, okay, if you don't do as they say, they feel like you're not trying enough to feel better, because it's like, well, why wouldn't you try? So side effects are brutal. I ended up in a wheelchair because of a hormone I had to take. I didn't know at the time it was because of the hormone. The doctor had never told me. I just realised that I couldn't walk. Like, if I was stood on my legs, I was in so much pain. It felt like my bones were going to crack at any minute. And I've still got the pains of endometriosis. They're not gone. But then on top of that, I can't walk anymore.
I value scientific knowledge very, very high. That is the basis of all my medical advice and the treatments. It must be so. We need research to know if it's a good or a bad treatment. The problem is that we lack a lot of knowledge when it comes to endometriosis. And then we have to go to our experience. We have this group of gynecologists in Sweden that work with endometriosis patients, and we meet 3 times a year and we discuss things and we write these guidelines and so on, so we can talk to each other So that is also good. And we get the guidelines from European societies and worldwide societies. So that is absolute foundation is based on research.
A lot of people notice differences and notice improvements with the way that they eat. Gluten is really the main thing that I've heard that a lot of people cut out. Spicy foods for me is a no-go.
So another super fun aspect of having endometriosis is when you have endometriosis in other parts of your body, like in your intestines, which makes everything involving your intestines more difficult. So in addition to all the medicine you normally take, you're supposed to drink this every day to make sure that I don't have a total block.
The patient's knowledge, they ask me a lot about, everything from different vitamins to diet advices. I don't want to discourage them, but I say that we don't know if this helps.
But why is it that there's such a lack of research and knowledge about a disease that affects so many women in such a profound way?
I think it's because it's a women's disease. I didn't want to believe that at first. There is some kind of idea still in our society. Women are not in such high regard as men, and women's symptoms are not taken seriously. You can still blame hysteria. Like women are hysterics that complain but don't really feel pain. It's not real pain. You can't have this much pain. And I'm not so sure that you say that to a man, actually. So I think we still have these old beliefs. It's very sad, actually.
It's such a thin line of, okay, so prove it to me that you really are in pain. And then sometimes you do or can prove it, or people can see like, okay, she's being sick, she's in pain, or she's burnt the skin off her tummy, okay, she's in bloody pain. But then sometimes that thin line of being like, oh, she's being overly dramatic because she's a woman. She's overly hormonal, she's easy to tears, it's all this or that just because I'm a woman. So it's like, how do you want it? Do you want me to like be quiet? Because I can shut up and be quiet and just be sick by myself in the corner. But then you don't believe me. But if I do try to show you and tell you, then I'm being overly dramatic. So it's a lose-lose situation. I can't do anything.
It's a lot to deal with mentally and to try to accept that there are a lot of things that you cannot control. And I'm not sure if I've even fully realized the capacity of how much this not only has already affected my life, but will continue to affect my life. I'm not sure that I've realized that. And I for sure have not come to terms with it yet.
Endometriosis is but one example of female discrimination within Western medicine. This system has been constructed with the male body as the default and the female body as the divergence. As a result, women's healthcare needs, such as interdepartmental inclusive care, are usually widely dismissed. Women particularly find fault in the lack of communication within the array of medical professionals that they deal with.
You don't have the team that's supposed to be a team. I would like to get called every 6 months or once a year at least to like make a plan with the team, to know who is my pain doctor, who is my regular doctor, who is my psychiatrist. But I never met the whole team.
My experience here is that they have too much to do. It's like there are too few people, so they don't have time to look at journals. I'm happy if someone basically knows why I'm there. So they don't know my history. So I have to start basically every time with saying, okay, I have endometriosis. it's stage 4, so it's really bad. I had these surgeries, and then I get the same questions. Why haven't you tried this? Why haven't you tried this? And then I have to say, okay, but I have tried this. So if they would have time to actually read the journals and see, okay, what happened, but also remember me, so I could actually meet the same doctor. I think I counted that I met basically like 10, 20 doctors here in Östergötland. So of course no one knows me and my problems, because if I meet someone just once, then it's starting over from the beginning.
You have the endometriosis specialist or the midwife, and you have that side. And then you have the other side, which is the pain doctor and the psychologist. And it feels like they are fighting each other. So the gynae side are saying they just want morphine, it's just this, it's just that. Whilst this side is trying to say, no, some people do need that pain medication, or no, they don't have a screw loose. They can't even have a conversation. So how are they meant to treat us if they can't even agree on what's right and what's wrong?
When you need to work with another specialty, that is very challenging, because we have like these small boxes. I am in the gynecology box, and if I need to talk to someone in the psychiatry box, it's very difficult. And most often you have to go through the vårdcentral, and maybe they are understaffed. You need to be a team sometimes around the patient, and that is difficult.
When I started to have my period, you didn't talk about periods because that was something shameful. So that was just something that women had to learn how to deal with. And there was no discussion of what's normal. I was bleeding so much more than every one of my friends. I didn't feel comfortable talking to anyone about it because that was the way it was. No one talks about it, and then it becomes a taboo. So for me, it was basically the last few years when people started to talk about endometriosis, then it's becoming okay to talk about it. But now people don't react when I bring it up and say, okay, I have this illness. Some people are still uncomfortable, but most people are like, okay, but that's really sad. And I don't talk about the exams and what happens in those with like colleagues. I can talk about it to my mom and dad, but those things are a bit more private and really painful.
Yeah, they certainly are.
If I could just scream from the rooftops, just look at me and see me for who I am. I'm scared of saying that, yes, I have PTSD from things that I experienced as a kid.
When I meet new patients, they are a bit afraid of how they will be met. In this area of gynecology, you meet women that has been exposed to traumatic sexual experience and also traumatic gynecology examinations. Sometimes you can meet a patient that you have met maybe several times, but at the 4th or 5th visit, she says, I have these memories. I have this PTSD after sexual assault, or after they tried to put in a spiral and I fainted. And then you have to start working with that. And also for endometriosis patients, it's often painful to do a gynecology examinations. So I don't always do that every time. And I also try to teach that to my colleagues. Try to think, is it really necessary to do a gynecology examination?
With bad healthcare encounters, it can vary a lot on how I react. I remember before I could react really aggressively. Not that I would act out and try to be aggressive towards someone, but it was out of pure frustration, feeling like I wasn't heard, I wasn't being helped, no one was listening. So of course it's frustrating. And if you then act out, then again, you get a stamp. Oh, okay, she's acting out, she's one of them. She's being a hysterical woman because she's so hormonal, or she's so drama queen, or, so you get that stamp. There are other more severe moments that you kind of freeze, because when I was younger, I experienced sexual abuse. And in that moment when it's happening, you can think ahead like, oh, I'd punch the fucker, or I would scream, I'd bite, I'd do this, I'd do that. But in the moment, at least for me, I froze. I couldn't do anything. I just froze. That I have the same reaction, that I freeze. I have the exact same reaction. I can't speak, I can't move, I can't say anything. I'm just frozen. Because 6 doctors are basically holding me down on a table, like an operating table, against my will, and trying to put an epidural, which is a needle that goes right into the spine, in the back. And I was freaking out, and I just said to them very kindly, I just need a moment. Just give me one moment so I can just prepare myself, and then we can do it together and safely and calmly. But they wouldn't listen. They were just being like, oh, this woman, like, ugh, God, get a grip. They basically all took a decision that pin her down. 2 people holding my legs, 2 people holding my arms, like one person behind my back trying to put the needle, one in front, because I was laying on my side, one in front trying to hold my body down. And I panicked. I said, please let me go. Can everyone let me go? I'm panicking. Let me go, let me go. It's my right. If I say, don't touch my body, then let me go. And they didn't. And they didn't listen. And then I went into that moment again, where I just froze. And after that experience, I just had loads of nightmares.
From a professional point of view, you have to be very careful with the patient. Try to not make it any traumatic and not a negative experience, because we know that they have to do examination for so many times when they get older. I try to talk very calmly, and you can dim the light. Also, I try to distract them. You know, you can talk about your children or your dog or what you have been doing today or about the weather. That has an amazing effect. Sometimes we only come a little bit and then we stop, and then the next visit we try to do a little bit more. And it's actually a very good thing. If everything goes well, it will boost your self-confidence, and you can, well, next time I can do this. And that's a very good experience for the woman also. But you should never harm. Absolutely not.
Amidst the poor healthcare encounters, the pain, and the stigmatization, there is a positive outlook on the future treatment of endometriosis. Specialists like Dr. Malin not only help in a medical sense, but also try to educate and reach out to women online.
With the Instagram account, I didn't realize that it was so easy to send messages. And I was, in the beginning, so much messages and everyone wanted medical advice. The need for knowledge was so big. You have to have borders, how much you can write. As a doctor, you have to make some difficult decisions. You come very close to your patients, but that takes energy also. So it's always something you have to try and have a good level of that.
Dr. Malin's Instagram account, Endometriosis.torn, already has over 9,000 followers.
I don't think that health professionals are so much in social media that is actually needed, because the patients are on social media, searching advice and searching knowledge, and sometimes they get advice from people that aren't healthcare workers or aren't medical educated. So I think it's very important that we are on social media. It's a thing that drives me to increase knowledge in people.
I remember when I was in high school, we had these discussions about sex in like the group in class, but there was nothing discussed about menstruation. But I think here would be the perfect way to just talk about it and say, okay, but if you have painful periods, you might want to talk to someone now and see, is this normal or not? To actually go and just see, okay, but am I in the risk of getting endometriosis, am I in pain now, or will I be in pain in the future? To establish a bit of contact and see, okay, well, what do they actually do in the healthcare system?
Exactly, so you can grab the people that are here, like in the beginning stage, not when they are like us and already probably have chronic pain. Like if you can prevent that, you should. And like no one told me in high school that like it's not supposed to hurt. You're not supposed to be home in like a week, a month. No one said anything. They should like invest in having support groups too. Patients with endometriosis and their families. It's like my husband is taking so much. He's anxious and he gets sometimes a little bit depressed because of me. Because I can't do anything and it's so hard for him to see me sad and it takes so much on me and it killed him to see me like I was feeling bad, and if he hadn't been there then I wouldn't have been able to pay my rent. Like he had to do that, he had to work and he had to fix everything, do the dishes, clean, just so I wouldn't like cry over that our apartment was messy. And like I think a support group both for us and the people close to us would be important, because it's not just affecting us, it's affecting everyone around us too.
This deeply flawed healthcare system can produce such negative effects that not only patients, but also those around them may need support groups. But this isn't the only strategy one can use to intervene. Women have various ideas and wishes on how to improve their healthcare experiences.
The endo house, where they have all the services for endo patients gathered, and the social aspect of health as well gathered there. And everyone has one special contact nurse. You have a certain plan made for you when you go into the acute stages, and you have one plan made for everyday pain, the pain you handle at home. You have follow-ups regularly, every 6 months at least, where you can talk about endometriosis and work life, endometriosis and sex, endometriosis and the fertile process, and also have some support groups. It's also very lonely to be an endometriosis patient, so I think to have care, therapy, treatment in group would be a good idea. But they should have the whole rehabilitation process from being acutely ill to being everyday ill and connected to the work life. Yeah, the whole life situation. That would be a dream scenario, the endo house.
But what about the next generation, or what about the people who aren't informed, who don't even know that this exists? I got this idea for a project to try and go out and speak to young women and girls about menstruation and about endometriosis and what are normal things to feel, but what are also red flags that you should be aware of. Not meaning to say that if you have one of these red flags, you definitely have endometriosis, but just be aware of it. So my idea was to go out as a project and speak in schools, and also hopefully be able to speak with healthcare, so they could hear from a patient's point of view. I could be an advocate for the patients, but also take in what they feel. What do we as patients need to think about and change and respect when it comes to healthcare? Because this is supposed to be a conversation.
I would like to say to anyone looking at this who think they might have endometriosis to just nag, as I did. Just seek help. If you don't get help, just continue. Go somewhere else. Go to a different hospital. Go to a different region. Because I don't know how many tests I've taken, blood tests and MRIs, where people said, but this is normal. You don't have any information. You don't have anything wrong with you. So there is still such a lack of knowledge about the illness and how you can see it, that you need to just look for people who know about the disease. It's really good help out there, but it's just a problem is to find it and to get access. And that's the problem. That's the hard part.
Well, two things. We don't have any treatment to make the disease go away, but we have a lot of treatments that can make you feel better and have a good quality of life. So the second thing is connected to that. Don't give up. Go to another doctor, seek help, and there is good help to get, absolutely. With the community together, we can increase the awareness of the disease and help each other.
In the waiting line, a few helping hands, your hope was high. You have had enough, it goes on and on, up and down, you suffer some setbacks. But don't give up, the sun will shine in the breaking sky. The first steps alone and then together to the top. Stay in touch, go ahead, the rain will pass before the elevator stops.